My name is Dr. David Samadi. I'm the head of the robotic program and minimal invasive surgery at Mount Sinai Medical Center in New York. I started using the robotic technology close to 10 years ago. The new era is very different than years ago when everything was talking about survival of prostate cancer. Now we want to beat prostate cancer with a good quality of life. I see a lot of patients in my office who are in their 40s. And you cannot possibly tell me that this guy is going to be impotent. Unacceptable. Now we're at a different era. Now we're at a different type of experience of surgery. If I can work in a bloodless field, I can bring the prostate extremely close to my eye and can see the detail of the surgery. It's almost like microscopic surgery. There's absolutely no reason for me to have my hands there, number one. Number two, a lot of people tell me, well, if you add all these tiny little holes that David makes and add them up, it would be the same as the incision that I make. And the answer to that is, when you make an open incision, as I used to do years ago, you're splitting the muscle. That splitting the muscle and putting it on traction for 3 to 4 hours causes a lot of pain. That's a longer recovery. If you're just using your hands and you're working in blind spots, you can damage the sphincter that leads to incontinence. You can leave cancer behind under the pubic bone because those are the blind spots. So these holes are not going through the splitting the muscle, and as a result, there's not a lot of pain. You have the light of the camera. You use the robotic technology to have the magnification. You can actually go under the bone and make sure that you're not leaving any cancer behind. By removing your prostate, you will find out how much cancer you have, what type of prostate cancer you have, what are the margins, what do we find in your seminal vesicles, the status of lymph nodes. Tremendous amount of information that with seed implant and radiation you will not get. And a lot of times, in 40% of the time, the preoperative biopsy is not the same as the final result. Those biopsies are not always indicative of what you really have in your prostate. A lot of times patients ask me, why do I prefer Da Vinci prostate surgery over the traditional open surgery? And many advantages of Da Vinci surgery is the fact that there's less blood loss, there is shorter recovery time, there's less complications, patients get to go home earlier. Typically they stay in the hospital only 24 hours. The time for removal of the catheter is also much less. So overall, getting back to work is much earlier. There's a huge benefit for patients when they go through the Da Vinci prostate surgery. I'm a Da Vinci surgeon because I saw the technology coming in when I was doing laparoscopic surgery. I was always very eager to see this field advance. I always saw that has to be a better way to do open surgery. And when laparoscopic prostatectomy started in France, I was very excited to learn that. When I saw the Da Vinci technology, I realized that this is definitely going to make it much easier for the surgeons and the patients. And that was really important to me.